Now that the wait for the Astrazeneca COVID-19 vaccines is over with the arrival of the first batch, more vaccines are being expected in the next few months. The first 3.94 million doses of the vaccine was delivered on Tuesday, bringing Nigeria's commitment to the inoculation of all its citizens one step closer to fruition. But as this hurdle is being crossed, the next challenge is how to adequately store the vaccines and begin distribution. TVC News' Kemi reports on this.
Nigeria becomes the third African country after South Africa and Cote d'Ivoire to receive its first shipment of COVID-19 vaccine doses from the COVAX facility. The vaccines allocated is the largest shipment made to an African country so far.
So we're going to be working with the states to make sure that at the point when the vaccines are being deployed, that they are ready to roll out and in a way to ensure that no vaccine is wasted.
Significant factor now is to get these vaccines to the state level, from state to LGA and into the health workers, the frontline health workers, so that they can be protected.
This first batch is part of 16 million overall doses planned to be delivered to Nigeria, which will come in batches between now and 2022. The National Agency for Food, Drug Administration and Control, NAFDAC, will ensure the safety of these vaccines before public use. Some of the vials from Tuesday's batch of the Oxford Astrazeneca vaccine will be here for the next 24 hours undergoing testing and analysis before it is approved for Nigerian use. Now, this will be a continuous process as each batch of vaccines that are shipped into the country will always be tested and certified safe for use here. All vaccines will be kept at the National Strategic Cold Store before onward distribution to states. Nigeria initially had plans to acquire 100,000 doses of the Pfizer vaccines by the end of February. And the concern at that time was the fact that vaccines had to be stored at temperatures of around -70 degrees Celsius, which means that getting into rural areas would have been quite difficult. However, the Oxford Astrazeneca vaccine seems to have solved their concern with its storage temperatures at 2 to 8 degrees Celsius. Nigerian health authorities say that Nigeria has 3 ultra-cold chain equipments with a total capacity of 2,100 liters, with more still being considered. The National Primary Healthcare Development Agency National Strategic Cold Store will be the sole storage for all the vaccines that will keep coming into the country in batches at intervals through the next coming months. They will be stored here before they start rolling out to states and other smaller cold chain storage facilities. But this facility is under very strict security and it will remain so. Kemi Balogun, TVC News, Abuja.
Well, joining me to discuss this is Abi Hector Goma, who is the GP and Clinical Director of the Chapeltown Primary Care Network in Leeds, United Kingdom. Thank you for joining us on TVC News at 10. Well, finally, Nigeria has received its first batch of the COVAX free vaccine, 3.94 doses. And storage was a big issue before now, but it seems the Oxford AstraZeneca vaccine is helping to manage that better. Let's talk about storage.
Thank you very much for having me on your program. To deliver a massive vaccine program such as this requires systems to be in place. It requires structures to be in place. They're not things that are done overnight. And I know that we are in a very good position to do things, knee-jerk reactions. But luckily, like you said earlier in the news, the Pfizer vaccine requires -70 degrees, but this requires just about the temperature of a freezer, which is a much easier thing to achieve. I guess the problem about storage at the national center wouldn't be much of a problem. I'm sure that would be easy to solve, but it's about getting it from a national center to the state capitals and then getting it to the people. That's the bottom line, where ideally vaccines should be given to the most vulnerable as well as to those at highest risk, the health workers. How to get it from the center to the periphery, that's where we need to have supply and logistics well planned out and in place. And it depends on how well that has been done before now.
All right, and government has actually said there shouldn't be a problem with storage. When the shipment was received yesterday, there was a whole lot of assurance that government has put in place proper machinery to actually handle a proper storage of the vials. Now, and just as you mentioned also, healthcare and frontline workers have been said by government as those who received this first batch of about 4 million doses. In all, Nigeria is expecting about 16 million doses from COVAX. How do you see this with the country's population at the moment?
I mean, if you look at today's statistics worldwide, 111 countries are already giving the vaccination, and Israel leads with 90 doses per 100 persons, followed by UAE, United Arab Emirates, giving 65 vaccines, and then UK is 35 vaccines per 100 people. So for a population as we have, my number one concern is that we, as a country, we do not have the systems or the structures in place. In the days of late Professor Likoyara and Samkuti, bless his soul, we had primary healthcare being well managed, and the system of cold chain was a bit better organized then, so it was easy to get vaccines, from center to periphery. But I think we've lost a lot of that that leverage, and I really have concerns that the system will work effectively. And then talking about who is going to get the vaccine again, like here we have a very functional primary care system. So we have a database of everyone in the country who is in a general practice. We know the clinically extremely vulnerable people. We have them on our database. We know how to reach them. There's good communication system between primary care practitioners and the patients. So I have my concerns that, I'm sorry to say this, but I hope that it's going to be a fantastic collaboration between the health system as well as the local councils, the community and voluntary sector, the religious bodies. And I hope that the various healthcare professionals, the doctors, nurses, physiotherapists, lab scientists, all their associations are actively involved, because they have a database of their members.
All right.
And they can, with the all-in WhatsApp group, they can easily get the members to attend. Okay. And unless they're involved, we may have a situation where a lot of these vaccines are going to other people and not from frontline workers.
All right, Dr. Asatis, Nigeria actually introduced an initiative where people would register, and if one is a frontline worker, I understand that individual wouldn't be able to go ahead and receive the vaccine. Abia Hector Goma, GP Clinical Director of Chapeltown Primary Care Network, Leeds UK. Thank you for joining us on TVC News at 10.
Many thanks, Jess.